alcohol was an early part of our white culture. Think of the rum corps. People were paid in alcohol. It's probably so much a part of our culture and our society that we're oblivious to it. And as a nation, we're drunk from preconception to death.
G'day, and welcome to Wellbeing. I'm Jack Hodgins. Today we are discussing alcoholism with conjoint Professor Adrian Dunlop from the University of Newcastle. Professor Dunlop has over 25 years of experience in the addiction field, both in a clinical and researching setting, and is here today to share his expertise into the topic. Hello Adrian, and welcome to Wellbeing.
Hi Jack, it's good to talk to you.
The majority of Australians drink alcohol, Adrian, but what is alcohol and why is it a drug?
Alcohol is a product that's fermented, like grapes or wine or barley or wheat for beer, or distilled, I think vodka, gin, etc., to make a liquid that when ingested can have an intoxicating effect on the brain. So it changes perception for a lot of people, but not everybody. It can have a positive sort of euphoric type feeling, a relaxing type feeling. That's essentially what alcohol is.
When does it become a problem?
When does alcohol use become a problem? For an individual, most of the problems generally associated with alcohol relate to intoxication. And just put very simply, the desired effect of alcohol is to have some level of altered state. Think of somebody who has a beer after work or a glass of wine with the association is about wanting to feel relaxed, calm, enjoying dinner or just enjoying relaxing, and so that's the sort of the stated aim for a lot of people in having some alcohol. The more you have, the more likely you are to get intoxicated. And what are the intoxicating effects of alcohol? Disinhibition. People do things they might not normally do. At a low dose, that might be quite enjoyable for some people. But at a higher dose, it can be linked to problems. So people do things that they wouldn't normally do, but there's a bad outcome. So what's an example? Get in a car and drive when you shouldn't and have a crash or hit somebody. That's an example of intoxication gone wrong. Climb up a ladder when climbing up a ladder can be dangerous at any time, but climb up a ladder when you've had something drink and fall off and break the ankle. Get into an argument. This is a really common one in Australia. Get into an argument with somebody, your partner, a friend, somebody you don't even know that you wouldn't normally do. Think of some guy at the pub. Hey, that guy's looking at me. He's looking at me weird. I better go and where the person's not looking at them or they're looking over their shoulder or something like that. So that's intoxication sort of and harm, or intoxication and problems. And that's, of all of the problems with alcohol, that's the biggest single problem. And the challenge is a little bit's nice, but a lot can cause harms. And where you draw the line isn't it exactly clear. And sometimes it's only clear after the event. Oh, that was too much last night. Or, oh, that was okay. I had a nice night.
So in a lot of ways, alcohol, when it becomes dangerous, is dependent on the individual.
And the setting, who they're with, the environment, what mood they're in, who else is around, how much they had. Did they get drunk really quickly or slowly? Have they got somebody else around them to say, hey, slow down, or maybe it's not a good idea to have another one. Maybe have a glass of water instead. So there's a whole bunch of things about, the alcohol. Like if you're drinking shots, you're going to get drunk way more quickly than if you're having light beer. If you've got an empty stomach, you're going to get drunk way quicker than if you haven't. Have had dinner before you start drinking. One of the reasons some people preload before they go out. They want to be drunk, and so they don't have dinner and they fill up beforehand. So it can depend on the drug and the sort of context and the environment you're in. All of those things can impact on what getting intoxicated or getting drunk is like.
Out of the population that drinks alcohol, which in Australia I think is about 85.5% that do drink alcohol, how common is it for a problem to develop? So
there's different ways of trying to measure this, but One that we measure pretty regularly. So every 3 years or so, there's a survey where we, or nationally, about somewhere between 20 and 30,000 people are asked questions about the use of alcohol and every other substance, tobacco, other drugs, etc. And that's been done since about 1985, so there's good data over several decades. So one of the things they use is this definition of single occasion risk. So our guidelines for alcohol say, on average, don't be having more than 2 a day, 14 a week. But if it was a special occasion like Christmas, birthday, something else, then our guidelines say don't have more than 4 on those days. Now, if you talk to a lot of Australians, they probably don't even know those figures. Maybe people have heard about the 2 drinks. The 4 drinks, I doubt anyone has. And most people would look at you silly if you said something like that. They'd say, what? It's the grand final. I'm drinking a slab, or I had a good night. Of course I drank a bottle of wine, or between us we had several. So a lot of people aren't aware of this, but this is one way of trying to define risk. And it's not just a number that's picked out of the sky. It's looking at many, many studies of alcohol in many, many countries, but including Australian data, and working out above this threshold that risk of harms like injuries, accidents, other harms goes up quite dramatically. And so that's 4 drinks. And when I say, what's the drink? It's a middy of beer, 100 mils of wine, a shot of spirits. That's a standard drink. So more than 4 of those on one occasion. So pretty consistently in Australia, it's about a quarter of the population report in the last month they've done that. Okay. So it's not saying there definitely has been harm. It's just there's a strong association between drinking more than 4 drinks and experiencing harm. So it's common. So I think that's like if you didn't know any of those statistics and you said, to somebody in the last month we had more than 4 drinks, you probably wouldn't be super surprised if 1 in 4 people said, yeah, of course I have.
Overall, then, how would you say, how safe is it to consume alcohol overall?
So there's a couple of really interesting studies. One that was repeated here locally, first done in Europe and then repeated here locally, and then another by a Canadian and German research group that tried to rank the harms of different drugs. So alcohol, tobacco, heroin, crack cocaine, amphetamine, cannabis, etc., mushrooms, etc. And all of the 3 studies came out with alcohol as the number 1 riskiest.
Okay.
That's probably a shock to a lot of people. Like, you said, what? The drug that's most easily available is the most harmful, but that's what different groups of experts, including local experts here in Australia, said. And when you start to look at the evidence of harm, then you might say, oh, okay, that's why they came up with that result. But there is an enormous amount of harm from alcohol every year.
You're listening to Wellbeing, a nationally distributed radio show and podcast. My guest today is Professor Adrian Dunlop, where we are discussing alcoholism. And in saying that it is quite harmful comparatively to other drugs on the survey you mentioned, why is alcohol allowed and the other ones that may be on that list not allowed?
This is going well beyond medicine, and you probably need to talk to a sociologist and historian and maybe political scientist too, because it's complex. In Australia, at least, I'll do my best, but I really don't think I'm an expert here. So think of our white culture, at least, comes from Britain. Alcohol is the British as a nation are heavy alcohol drinkers, including alcohol binge drinkers. If you think of different cultures, the Mediterranean style of drinking, where people don't binge in the same way that Central Europeans and Northern Europeans do. There's a difference there. So in other cultures, alcohol is frowned upon. In many other countries, many parts of Asia, Africa, alcohol is not drunk at all. It's part of their religious culture as well, but it's not used at all. So there's differences in different countries. But Australians, a lot of the migration, especially early, was from was from Britain, and that's, and Ireland and Scotland, etc., countries with lots of histories of alcohol use or heavy alcohol use, binge alcohol use. Alcohol was an early part of our white culture. Think of the rum crawl. People were paid in alcohol. That was not uncommon. It's probably so much a part of our culture and our society that we're oblivious to it. And as a nation, we're drunk from preconception to death, and we just don't realize it. If you think of how important alcohol is in celebrating a birth, celebrating a birthday, celebrating Christmas, celebrating finishing work, celebrating the football, the cricket, celebrating, commiserating a death, commiserating a loss, commiserating tragedy, celebrating success. Like everywhere along the way, alcohol in Australia is inextricably part of our culture. And it's only, probably personally, if you're in a situation where you just can't drink for one reason or another and you need to go to an event, you realize, wow, it's really hard. I've got to refuse alcohol on lots of occasions to get through that event without drinking. And it's interesting to look at people get drunk when you're not drunk. So it's really strongly part of our culture. It's a social culture. And I guess I'm talking to you about harms from alcohol. I don't deny people enjoy alcohol. They wouldn't drink it otherwise. There's, and it's really important, I think, to acknowledge that why is alcohol part of our culture? Part of it is because people enjoy it. And that's why there's such a drive to it. I'd broaden that to say human beings enjoy intoxication. There's no culture that's recorded that didn't take some sort of intoxicating substance for some sort of benefit. I mean, part of their ritual, culture, spirituality, but, stimulants or sedatives or intoxicants of some sort, every culture on earth. So getting off your dial to some degree is part of the human experience. In Australia, alcohol sort of, the number one.
Okay, so we highlighted that. We've highlighted on the harms and we've highlighted on the prevalence and in the culture. Is that then because it's so ingrained in our culture? Is that necessarily a bad thing? Is there anything we need to work on with that, or is it just, as you say, part of the human condition? I think you said it was.
I probably have a bias here. I work as part of the healthcare system. I'm sure it's not any news to say to people the healthcare system's overburdened. We've had a pandemic for a few years, but even before that, healthcare system's overburdened. Australians are getting older. There's a lot of pressure on emergency departments, GPs, hospital systems to be more efficient, see more people. The costs keep going up. We're told it's unaffordable. So we've got to look at the efficiency of our system. So there's probably some things that we could do quite sensibly that might reduce the impact of alcohol. So alcohol kills about 5,500 people each year. There's about 160,000 hospital admissions directly related to alcohol. It drives about 50% of recorded domestic violence assaults, generally against women, and that's probably an underestimate. Other assaults, not domestic violence assaults, somewhere about half, 70% are related to alcohol. 1 in 5 to 1 in 3 people sitting in an emergency department right now have had too much to drink, and that's part, possibly, of why they're there. 1 in 4 people sitting in a GP surgery are drinking too much. 1 in 3 road deaths are alcohol related. It costs us somewhere between 15 and 36 billion a year. In terms of taxation from the alcohol industry, we get about 7 billion back. So we're footing the bill well and truly. It's not like there's a net benefit because of alcohol. There's a net cost. Heavy drinking, so people are drinking way too much, is responsible for about half of all of the alcohol sales. And it's that group who not only have the acute problems, but also have the long-term expensive healthcare problems. So some simple things to drive down very heavy drinking could have a very significant benefit for society, for those individuals, the individuals, around them, their families, friends, others, but also in terms of cost. So in my mind, that's where we should be tackling things, making it a little bit more difficult for people to drink very heavily.
How long does it take to get addicted to alcohol? Is it a gradual kind of thing?
Yeah, so addiction, that's a great question. And maybe we should spend a moment just sort of defining it. So up until now, we've been talking about, problems or harms related to alcohol. So it's possible, for anybody to experience problems or related to harm. Some people have a sip of alcohol and say, that tastes disgusting. I don't drink that again. Or they'll have a few drinks and the next they'll think, oh, my head, that feels up. I am never doing that. And they don't drink again. So that can happen. Tragically, sometimes really, at a young age, people drink way too much and end up dead. Think of some of the schoolies deaths we've had. We haven't had them in the last 2 years because we haven't really had schoolies in the same way. But every couple of years, you hear of a very sad incident of some young person just finished school, and had a very big night out and ran in front of a car or fell off a balcony or something like that when they were drunk. So harm is possible at any stage, even from early use. But what's addiction? Addiction is generally a chronic problem, a long-term problem, not an acute problem like that of just having too much to drink once. And addiction is basically where people lose control of being able to say no to something. So, a good example I can try to give you. I'm not talking about alcohol, but I'll talk about coffee. A lot of Australians drink coffee. Just before you called me, I had enough time to run downstairs to the coffee cart and grab a cup of coffee. And, I enjoy the cup of coffee and it tastes nice and it's satisfying, and I like to have a couple of cups of coffee in the morning. But if I didn't have time, I just would have taken your call and, kept on talking. So I think I can control my coffee use. If I couldn't, I just said, oh, no, Jack can be late. I don't mind. I'm gonna bum out on you and go and have my coffee, and I'll be late for the call. Then hang on, who's controlling this? Is it me or is it the coffee part of my brain? So when you start to be able to say no when you should be able to say no, that's when there's some ideas of maybe your relationship with this substance is starting to become unhealthy. So loss of control is the sort of central concept. There's a number of different ways of measuring it, but a really simple one that people might relate to would be the question: has somebody said to you, "Hang on, maybe you've got a problem with"? We're talking about alcohol, so say alcohol at the moment. That's actually not a bad measure of a non-scientific measure, but a way of working out. Hang on, maybe something's going wrong here. So addiction, it's complex. It happens over a few different stages. At the start, people take a substance, alcohol, and feel good, and they feel good. But then if they find that they need to drink more and more to get an effect, that's sort of heading towards an increased risk of addiction. Or alcohol dependence is a term we use medically. If that keeps going on and you drink regularly, and you almost have to drink to function, that's when you are heading for alcohol dependence or addiction. So in that case, you've got to take alcohol, because if your brain's deprived of alcohol, it starts to really respond negatively, and people get sick. They get alcohol withdrawal, the shakes or the tremors. However, it's a little bit more complex than that. Usually, addiction is not just about a substance use. Usually there's something else or a number of other things going on there. Mental health concerns, depression, anxiety can drive it. Having a long-term pain problem, that can increase the risk. Social problems, being poor, homeless, that can increase risk. Having experienced trauma, assault, sexual assault as a kid, a number of things, especially lots of episodes of trauma, that really increases the risk. So addiction or dependence is usually something not just, yes, it's about the substance and it's about problematic use of a substance where somebody loses control, but usually there's other stuff entwined as well, where there's reasons that person hasn't been able to work out to say no, and hang on, I've got to get this under control.
You're listening to Wellbeing, a nationally distributed radio show and podcast. My guest today is Professor Adrian Dunlop, where we are discussing alcoholism. How should we outline alcohol use disorder then? Was it considered to be a disease?
So it does sit in the International Classification of Disease, alcohol dependence. There's a couple of categories before that, so that's sort of like problematic use or harmful use is the term they use. That you can diagnose when somebody has too much, and it can now even be on a single occasion, or it can be on multiple occasions. But yeah, dependence is basically where it's a syndrome where people are losing control and there's ways of trying to demonstrate that they can't do what they normally should be able to do, go to work, go to school, fulfill some of their major obligations in life because of the drug. Another way of thinking about it is, despite evidence of mounting harms from the drug, they continue to use it. And then there's those physical symptoms of tolerance I spoke about before. So you have to drink more to get the same effect, or even more extreme, you stop alcohol and your body doesn't tolerate it. You get sick because you haven't got alcohol in your system. So it doesn't have to be all of those things, but combination of those symptoms is what medically defined as dependence.
Can alcohol affect the genders differently?
Absolutely. There's a whole lot of different pressures and permissions in society, if you like. So it's probably, maybe the difference is less for younger people today, but historically, alcohol use has been far more alcohol intoxication has been far more tolerated in men than women. There's something generally about men across a whole lot of things, that men are more likely to take risks than women, so maybe more likely to drink in a risky way than women. However, women may be more likely to progress from heavy use to dependence more rapidly. The social stigma around alcohol use can be greater for women than for men. And then when you start to think of particular situations like pregnancy, it gets pretty complicated. So, generally women don't drink in pregnancy, but of those who continue to, there's a small group who drink very heavily, and there's lots of concerns associated with that. Clearly that's different from men because they're not carrying babies, and often there's a split in social circumstances and those sorts of situations if men are drinking heavily during a woman's pregnancy and their partner isn't. So, yeah, it's complicated, but yes, there's differences.
Can genetics affect the likelihood of someone becoming dependent on alcohol?
Yes, genetics is an important driver and can also be protective, but if you look at people with a family history of alcohol use, there's sort of two patterns you can see. You can see that there might be an increased risk for some in also drinking alcohol or using other substances, but for others, there's a reduced risk, and that's both genetic and probably social too, of people sort of realizing, my dad drank way too much. I'm not going to do that. Look at the mess his life ended up being. But for others, it was the reverse.
What's the situation like with Australia's youth then, with alcohol dependence?
We've got more data now than we had, 20, 30 years ago about young people drinking. There's a concern that there's a pattern of younger people drinking more and drinking more heavily, in particular binging and heavy binge use. So that is a real concern. And that's probably been going on for some period of time. So, when I was saying before, something like a quarter of people generally drink heavily in the last month. That's higher for younger people. So it's, a third or maybe even a bit more than that. However, there's some positive signs too. So if you look over the last decade and a half or so, on average, adolescents are starting to drink a little bit later. So that we think is a good thing. And, the general recommendation these days is the longer you can leave it before you start alcohol use, maybe that's better for people. So yeah, evidence in both ways.
Is there a lot of stigma towards those that do struggle with alcohol use?
I think people with any dependency or addiction, there's stigma, and alcohol, certainly there is. And it's one of the reasons, not the only reason, but it's one of the reasons people find it very hard to admit to themselves they've got a problem, and then to go and seek help for that. It's the stigma around addiction is, I guess, if we think about, what the stigma around poor mental health used to be decades ago, that in my mind is where the stigma about addiction is now. It's not talked about. Mental health gets talked about. Does addiction get talked about? No. Try to think of an example in the last 20 years of any politician anywhere who's gone out saying, hey, I'm going to increase funding for addiction services. I can't think of one.
No.
They like, what a way not to get voted in. That's what their advisors saying. And don't talk about it. And sadly, our The problem isn't going away in society, and with an aging population and a population slowly increasing, our treatment services aren't increasing at anywhere near the rate. There's a huge gap between demand and supply, and that translates into generally once people have got a problem, it's over a decade, 15 years before people are starting to seek help. And if you think of the harm that can occur in that time, the arguments, the violence, the physical health problems, the mental health problems, not good.
So in a lot of ways, do we need to really talk more about addiction so that the more people understand it so that we can actually take the action that we need to do?
I think so. And I think, again, if you look at the discussion over the last couple of decades, and there's some data in this, in that household survey I was talking about before, they asked some questions about, general public attitude to people who have problems, and that's changed. And so the stigma is dropping, but it's still there. But yeah, we need to be able to talk about it. It shouldn't be something that's shameful. It should be something that's thought about as a health problem. And we should be, as a front line, having a health response and a social response.
We've spoken to quite a few people about addiction on this show, and I think something that's very important that we highlight is that addiction is not a choice, is it?
No, addiction. I've never met anybody who's said, "Oh yeah, I picked become addicted to alcohol or any other substance for that matter. That's something I wanted to do. I jump in head first." No, it's never like that. Often people have tragic stories behind it.
My guest today was Adrian Dunlop, Conjoint Professor from the University of Newcastle. And if you like this content, check out the Wellbeing podcast for more. Thank you for listening. I'm Jack Hodgins, and all of us at Wellbeing wish you well.